In 2017, the president of Uganda, Yoweri Kaguta Museveni, launched the Presidential Fast Track Initiative aimed at eliminating AIDS strictly by 2030, 37 years after registering the very first HIV/AIDS case in the country. Since the launch of the PFTI, the government has made significant strides towards this vision by containing the prevalence of new HIV infections from 68,000 in the 1990s to 38,000 cases today. According to the Uganda AIDS Commission, the country's 2030 vision of eliminating AIDS as a public health threat hangs in balance, as the virus's prevalence among the adolescents, particularly females, remains high, in addition to the annual 4,700 infections among newborn babies.
We had set targets that by 2025, we should have reduced new HIV infections to less than 20,000. So at 38,000, we have not yet reached the target, and we may not be able to hit the target of 2025 of less than 20,000 new HIV infections in a year. And similarly, having 4,700 babies each year acquiring HIV from their infected mothers is still high, considering that the technology is there. We have the drugs, we can test the mothers in time, and we have the counselors. We can support these mothers. And therefore, with all this in place, still seeing 4,700 babies getting infected with HIV is still on the higher side.
Dr. Vincent Bagambe, the acting director general of the Uganda AIDS Commission, attributes the high prevalence to a number of factors, including multiple sexual relationships among adolescents, suboptimal condom use during high-risk sexual activities, among others.
We see deteriorating behavior towards the risky sexual behaviors. And this, allow me to expound a little bit about this. We see more people engaging in multiple sexual relationships. That's a risky sexual behavior. We see fewer people using condoms. That's a risky behavior, especially if you are engaging in risky sex.
Jacqueline Makoka, the UN AIDS country director, maintains that both Eastern and Southern Africa is still the epicenter of AIDS, and that the female's risk of acquiring the virus is 6 times ahead of the female counterparts, something which underscores the need to renew the concerted efforts in actualizing Uganda's 2030 vision.
Now, when you look at the Eastern and Southern Africa, as we've always told you every year, it is still the epicenter of the HIV epidemic. Young girls in our region of Eastern and Southern Africa are 6 times likely to acquire HIV as compared to their male counterparts. And we know that they are most at risk of not only of HIV, they are also at risk of getting early pregnancy, falling out of school, maternal health complications. And so HIV is not only in isolation, it's interplaying with so many other factors that affect young girls.
It is upon this ground that the board chairperson of Uganda AIDS Commission, Dr. Ruth Senyonyi, urged the parents and guardians to acquaint their children with HIV/AIDS preventive information in the wake of unfiltered social media content proliferation.
And if we are to achieve the goal of ending AIDS as a public health threat, we need to accelerate interventions. There are some areas that we need to focus on, and the first one was ably talked about by the UNAIDS country director. Almost half of new infections are adolescent girls and young women aged between 15 and 24. With the proliferation of media, especially social media, we urge parents, guardians, teachers to talk to your children about HIV/AIDS. I realize that any child who is below the age of 20 may not know much about HIV like I know, because I've seen Fidel Retire that they talked about. We've seen people who have struggled with HIV, but many of these young people have not.
In the spirit of sensitizing and mobilizing the public against the epidemic, Dr. Senyonyi launched a campaign dubbed Wear a Red Ribbon campaign, upon which everyone is compelled to go to a health facility and ascertain their HIV status as the country gears up for the annual National HIV and AIDS Symposium.
It is now my honor to launch the Wear the Ribbon campaign. As we move toward commemoration of World AIDS Day, let us rally all our constituencies, all our people to wear a red ribbon daily in solidarity of those who have been infected and affected by HIV and AIDS.
The annual National HIV and AIDS Symposium is part of the PFTI 5 pillars, aimed at bringing together key stakeholders to take stock of their achievements and also share experience on what worked or never worked. This year's symposium is slated for the 13th day of November at the office of the President Conference Hall under the theme, Accelerating Interventions to End AIDS by 2030. Joseph Kabale, UCTV News.